going to hear next, also via video, from one of our most important contributors in these sovereignty summits. I think he's participated in almost all of them. His name is Alex Newman. He is the president of Liberty Sentinel Media. He's an award-winning international journalist, educator, author, speaker, investor, and a radio, TV host, and author twice, including of indoctrinating our children to death. Alex is a polymath, as far as I'm concerned, a man of formidable intellect who has given a lot of thought to what the globalist agenda is about and what it has in mind for all of us. We've asked him to drill down on something that I think has been mentioned in passing, but we wanted to get a fuller analysis of it. This program called One Health, the various nature of it, the threat that it poses, not least to states' rights and ours. Let's go to the video with Alex Newman at this point.
Hey guys, thank you. It's a great honor to be here. I really appreciate it. I'll try to go as quickly as I can just because we have limited time. I was asked to speak about One Health, and I think One Health needs to be understood as an effort to redefine healthcare in collectivist terms as one element of it, and also to bring back a pagan-style worldview in terms of humanity's understanding of its purpose and its place in the universe. So it's very, very dangerous on at least those two fronts, plenty of others as well, but I want to just focus on those two. And when I say collectivism, I don't just mean in the communist sense, where the interests and the rights of an individual have to be subordinated to the collective or the people, as they used to say. Under this One Health notion, the individual's interests and rights have to be subordinated not just to the people, but also to these nebulous notions of Mother Earth, the environment, ecosystems, climate, etc., and the supposed interests of other living organisms. And so by doing this, health, broadly understood, then becomes the pretext for virtually any tyrannical policy one could imagine. One that's very obvious here is the climate change thing. They're arguing that CO2, the gas we exhale, is dangerous, toxic pollution. From a scientific perspective, obviously that's totally absurd. Human emissions of CO2 make up a fraction of a percent of all the greenhouse gases naturally in the atmosphere. But because every human activity results in CO2 emissions, and CO2 emissions allegedly cause climate change, and climate change is allegedly bad for your health, therefore every regulation, every control on human activity now is not just about saving the climate, it's about One Health. It's about preserving the health of the ecosystem, the animals, and the planet. Now, I actually had the opportunity to talk to a very, very top-level UN World Health Organization official about this very issue at the most recent UN Climate Summit. I was in Azerbaijan, and I'm going to share that video with you so you guys can see what she said when I asked her about this idea that climate change was actually a public health issue. So let me play that for you. You can see what she had to say.
So we've heard a lot, including from the Director General of the WHO, that climate change is a public health crisis. Could you explain to us how that works and what does that mean for policy?
What that means is that climate change represents a global warming, and global warming creates perfect conditions for certain diseases transmitted by mosquitoes, for instance, like malaria or dengue, to have better conditions, and those vector-borne diseases will have an increase. Same for water-related diseases, waterborne diseases. When you have a drought, or you have a meteorological, extreme weather event, you might change as well the precipitation pattern. You might change the ecosystems, and that again will create the conditions for diseases related to water scarcity, like diarrheal diseases or cholera outbreaks and all of that. Of course, if you touch the production of food because you have an extreme weather event and you cannot cultivate, you don't have an agricultural production, you will have negative impact on nutrition. If you, the combustion of fossil fuels that are responsible for the global warming creates as well air pollution, and that air pollution every year we have 7 million premature deaths by the bad quality of the air we breathe. So there are many things that are touched, the pillars of our health, the quality of air, the quality of water, the shelter, and the production of food are shaken by the climate change aggravates or multiplies those threats to our public health.
So that was Maria Neira. She was the director of the World Health Organization's program on climate change and public health, one of the top officials there. And I'm telling you, folks, what she just explained there is that everything having to do with climate change is now a health issue. That's why the Secretary General at that UN climate meeting said climate change is the most urgent health issue we are facing. So think of all the tyranny they brought in during COVID under the guise of saving us from this alleged health issue. Now imagine that everything you do is somehow bad for the health of the ecosystem, which is bad for the health of the planet. Now, the World Health Organization describes One Health this way on their website. They say, by linking humans, animals, and the environment, One Health can help to address the full spectrum of disease control, from prevention to detection, preparedness, response, and management, and contribute to global health security. They also said that One Health seeks to sustainably balance and optimize the health of people, animals, and ecosystems. So, folks, as they were doing this One Health program, they were systematically, in their international agreements, including the pandemic agreement, systematically eliminating references to human dignity, to human freedom. And there's a reason for that, right? One of the interesting things about the One Health high-level expert panel, which is driving this crazy train, they have way more veterinarians than they have experts on human health. Just 4 out of about 24 of these people actually have training in human medicine. Many of them have training in veterinary medicine. Obviously, humans are not animals, and it should go without saying that humans and human health are dealt with differently than animals, right? We throw critters into a cage. We slaughter animals if they're sick. We don't do that to people. Why are they doing this? Why are they blurring the lines? It's very strategic. Now, if you look at the other members of this One Health high-level expert panel, you've got senior members of the Chinese Communist Party, including the former head of the Chinese CCP, CDC. You've got multiple folks there with strong connections to Peter Daszak and the Eco Health Alliance of Fauci fame. Okay, so these are very, very dangerous people, and unfortunately, all of this has now been embedded in the bureaucracy, in our institutions here in the United States, in our public health bureaucracies, in our academic institutions. I just looked, CDC still has a whole bunch of stuff about this One Health. They define it as a collaborative, multi-sectoral, and transdisciplinary approach working at the local, regional, national, and global levels with the goal of achieving optimal health outcomes, recognizing the interconnection between people, animals, plants, and their shared environment. So, folks, they are telling you what they're doing. And again, this is going to underpin massive levels of tyranny. And all you have to do is look back into the history of the people who've been promoting this. If you look at the Club of Rome, for example, an alliance of communists, globalists, population control nuts, and New Agers, they declared back in 1991 they were searching for a new enemy to unite us, that the real enemy was humanity itself because of the environment. Do you see how this works? Some of the luminaries of this movement, like Obama's science czar, John Holdren of eco-science fame, he wrote in his 1977 book with some of the key people involved in this movement that to save the environment, which now, again, applies to human health, we should consider forced abortions, which he said could be sustained under our Constitution, a planetary regime with international armed force to control humanity. He proposed adding sterilizing agents to the water supply to prevent unwanted births. He proposed forced sterilization of people who would contribute to social deterioration. Now, the repaganization element here is very, very significant. We're not going to have time to get into it. But, of course, the Judeo-Christian worldview based in the Holy Scriptures holds that God created man as the pinnacle of this creation. He put man in charge of the planet and the animals. And so the earth and everything in it and on it are here for the glory of God and the benefit of man. By contrast, the paganistic, atheistic, and pantheistic worldviews that animate this One Health idea, Gaia worship, Mother Earth, New Age, hold that man is just one meaningless component in this broader system with no real transcendent value. And I've watched this happen. I was at the UN Climate Summit in Egypt, where all these religious leaders unveiled the new 10 Commandments that hold that we need to serve this interdependent and life-giving earth, that compassion means feeling the pain of Mother Earth. So I'll say it again, folks, even if One Health was good or desirable, because it comes from the WHO, it needs to be rejected. Trump did a great thing by getting us out of the WHO, but this One Health stuff is already embedded in our institutions, and the whole notion is wicked, needs to be pulled up from the roots and thrown in the trash. Trump can lead the way and get it done. Thanks, guys, and God bless you.
Thank you. Alex, as always, repaganization, I think, is a term we're going to have to spend some time mulling and discussing here momentarily.